Okay, thanks very much everyone for coming. I think we're going to start our side event, which is entitled Research and Learning Priorities for Integrating Hygiene and One Health. And it's going to consist of a few case studies and then a collaborative discussion session. So the learning objectives for today are understanding the rationale for integrating hygiene into One Health, and then secondly, considering the priorities and challenges that come with trying to integrate the two together. So the plan for the session today is we're going to kick off with an introductory talk from Dr. Kelly Baker from the University of Iowa, and then we'll have 4 quick-fire case studies, followed by a breakout session which uses the World Cafe method, which is quite a fun, dynamic, interactive session, so kind of a lot of moving around the room. And the kind of key aim for that is discussing and identifying the priorities and challenges for integrating hygiene and One Health. So we'll kick off with Kelly.
So this is really just going to be more of like a short primer rather than a lecture. I left the professor me back in Iowa. All right, so I know most people in this room are familiar with One Health, but I'm going to just define it so that anybody who is not familiar with the field is on the same page. All right, so One Health is defined as the sort of set of activities and programs and efforts that aim to promote the health of people, animals, planets, and the ecosystems with which we all sort of exist, right? So it's not lifting up human health over any other piece of this ecosystem. And so the activities that are sort of focused on, achieving One Health goals are typically aiming at least at 2 of those pieces, animal and human health, or plant health and animal health, right? So they're multidisciplinary efforts, right? So when we think about the role of hygiene in One Health, I mean, when hygiene, most people first think about hand washing, right? It's what we all sort of come to this conference every single year and listen to talks about. Hand hygiene has this really pivotal role in the classic F diagram for sort of preventing the transmission of pathogens from hosts and contaminated environments into people. There was a paper a couple of years back that reimagined this F diagram in the context of animal sources of contamination and the capacity for sort of pathogens from animals to be passed through the food supply chain, through the environments with which food is prepared. This suggests that there are a lot of other environments other than hand hygiene that play this really important role in, preventing the zoonotic transmission of pathogens. And if we, take a step back and learn from history about, what does environmental hygiene, how has that contributed to sort of reduction in infectious diseases in countries where that disease burden is low now, there's a lot of historical precedent. At the sort of turn of the 19th century, there were a lot of other sort of societal transformations that were happening at the same time as institution of drinking water systems and the emergence of sewers and sanitary systems. This is also when pasteurization was discovered, right? And so pasteurization emerged in the late 1800s and became sort of over the first part of the 20th century an important part of food supply into urban settings in particular. And it's now, sort of hygiene, personal hygiene and environmental hygiene is codified probably most strongly, in the food sector, right? There are very rigorous guidelines for what kind of environments and personal behaviors are required in order to participate in this food production, preparation, and transportation system. There's also a lot of evidence about urban development and the role of sanitary sort of policies that were also being instituted in the late 1800s and early 1900s. So up here down here on the left, these are workers that were employed in some U.S. cities in the sort of late 1800s in response to urban policies that required streets to be cleaned, right? So people got fed up with all of the trash and sewage on the streets, and so an entire workforce was employed just to keep the streets clean. This graph over on the right, there's this sort of really there's a group of really pivotal public health researchers in the late 1800s and early 1900s who were watching a lot of the transformations in typhoid and cholera and other things change in the U.S. urban landscape. And many of them actually thought that one of the big changes in disease burden was due to the sort of emergence of industry, right? When cars started taking over roadways and displacing horses and mules and other types of animal transportation, there was a noticeable change in the amount of animal waste that was across the streets in many of these urban settings. So, point being is that there are a lot of different types of hygiene interventions that are really important for disease control and prevention. And this also applies when we think about, animal health. So last week, I was listening to James Bagura from the PREDICT program give a talk at the American Society of Tropical Medicine and Hygiene meeting, and he provided a really interesting case study about how the COVID-19 pandemic provided a lot of insight on, reverse transmission and how human hygiene behaviors were influencing animal health. And so what he pointed out was that prior to COVID-19 pandemic, they were observing a 10% fatality rate among a lot of baboons at an animal sanctuary, specifically the Gola Rainforest National Park, from respiratory diseases. So these baboons were acquiring respiratory diseases that are the same as human respiratory pathogens. But they had a much higher death rate. And when COVID-19 occurred, and all of a sudden workers were not going into the parks and interacting with the baboons as much, the infection rate and the death rate plummeted. And what they figured out through some genetic work was that the workers in this park were at home with their kids. Kids are dirty little creatures, right? They pass around all kinds of pathogens. And so as a parent, you're constantly sick in the first couple of years. So these workers were asymptomatically picking up a lot of these respiratory viruses from their kids and then taking it into the park and passing it on to the baboons, right? So hand hygiene and environmental hygiene as well are also really important for, so protecting other species other than ourselves. Right. AMR is also a really important topic in the sort of hygiene and One Health space, and you're going to hear the first case study today is going to be about AMR. So this is the One Health Priority Research Agenda for Antimicrobial Resistance Control, put together by the WHO and the food and ag industry and United Nations. And so this is sort of articulating the different concerns that have to be tackled through action to prevent transmission of bacteria that are carrying antimicrobial genes that can be transferred to each other and then also create disease treatment problems for humans and for animals. So while One Health is scientifically, a set of research questions that we all think about, because of the complexity of the problem, it requires a lot of cooperation, communication, and coordination across sectors. So there are also these very operational pieces to conducting One Health sort of programming. And a lot of that includes capacity building as well. Capacity building isn't necessarily just a sort of building up laboratory facilities and transferring knowledge to low-income countries, for example. It also is about making sure that people in clinical fields of work appreciate and understand the sort of importance of public health actors, agricultural actors, other people in this same space, and work together to solve some of these problems. All right, so this is just kind of a first, I know that the words are a little small, but this is just like a first draft that I created of something that was trying to think about how a lot of the One Health problems or One Health issues that need to be addressed are situated in not just in the human, animal, and environment sort of traditional triad, but also contextually in the broader environment. Let me see if I can find a pointer. Okay, that's a pointer. All right, so I'm going to just yell. So, for example, we have these sort of interspecies health-related issues like hand washing and rodent control that affect animal health, both domestic and human. But humans and animals that live together live in these broader local ecosystems where you can have wildlife, domestic animal spillover issues. These local ecosystems are situated in larger ecosystems, often with shared watersheds. There may be shared vectors like mosquitoes, et cetera. And then, of course, kind of connecting to climate change, there are these bigger global systems as well, where you have hygiene issues related to, for example, migratory animal transmission of pathogens, or importation, right? Airport hygiene issues where you might have things brought in through food or people. All right, so the issues that we talk about with One Health are interconnected with a lot of other actors out there that are focused on pandemic control as well. So the USAID PREDICT program and the Stop Spillover program, hygiene is at the heart of these programs as well. It's not just about endemic disease prevention and control, but also about preventing the organisms that we don't know yet. So at that, I am going to hand it back to Max. Yeah. Thank you.
Thanks, Kelly. So now we'll move on to the first of our case studies, which will be from Fanta.
Okay, good morning, everyone. I am presenting on behalf of Addis Ababa University and Reckitt Global Hygiene Institute and the University of Iowa. I'm situated in University of Iowa. So I try to put this information from the literature. So I wanted to clear myself ahead of time. This case study is not my study. So I'm trying to conceptualize how we can put hygiene at the heart of One Health for the purpose of preventing and controlling antimicrobial resistance. Just as you all know, antimicrobial resistance is just a kind of defense mechanism by which microorganisms defend themselves from any threat from the environment. And the antimicrobial resistance is, in other words, it is a threat for public health and the global economy. So currently it is a hot issue in national, international, and the global level. So there are a number of factors that really involve in emergency and occurrence and the spread of antimicrobial resistance. And the primary factor is, in most of the case, it is the usage related to antimicrobial resistance. In most of the case, there are an extensive overuse and the misuse of antimicrobial resistance in animals, in humans, and the plants, and the other agricultural sectors. Just other factors really can exacerbate the occurrence and the spread of this antimicrobial resistance. Of these factors is, which is the focus of these presentations and the side event, is hygiene. So lack of hygiene is, in most of the case, involved in occurrence of infections and then related to emergency of antimicrobial resistance. So the subsequent case studies are try to link with the hygiene and antimicrobial resistance. So in the first two case studies, I will try to link how antimicrobial resistance and the One Health can be linked each other and how we can put antimicrobial resistance at the center of One Health. And then in the third case study, I will try to show the interlinkage between hygiene, antimicrobial resistance, and the One Health, which is really the focus of this side event and the presentations. So as you can see, in general, once antimicrobial resistance organisms really emerged, they can easily spread among the three main domains of the One Health at humans, animals, and the environment. So the transmission cycle is really a kind of vicious cycle. So once it emerged in environment, it can easily get into humans and it gets into animals. So in the same way, if it emerged from humans, it can easily get into the environment and the animals. So the transmission cycle of antimicrobial resistance, especially once it is developed a resistance genes, it can easily spread within the One Health domain. So as a result, antimicrobial resistance, we can say definitely that antimicrobial resistance is one of the cross-cutting issues of One Health that needs a One Health collaborations and communications. This is a kind of systematic review that is really published from Ethiopia in this year within the context of One Health. So they try to summarize any literature that are published in a study in Ethiopia, and try to look into the occurrence of antimicrobial resistance organisms in animals, in humans, and the environment. So among these studies, I try to extract the burden of E. coli. So E. coli is the most prevalent resistant bacteria from the systematic review. And then when you compare the prevalence or the incidence of this antimicrobial resistance across animals, humans, and the environment, there is high report from human settings, which could be the availability of the literature. In most of the cases, many studies are really focusing in health setting and the human conditions. But here, you can clearly see that these resistance organisms really occur in the environment, in animals, and the humans. Even though this systematic review doesn't show the interlinkage of or the genetic relationship of this bacteria, but it clearly indicates that resistant E. coli really is spread across the environment in Ethiopian situations. This study from Nigeria really further advanced the result from just the kind of the systematic review. They conducted an extensive research by taking a number of or several samples from humans, animals, and the environment, and try to look into how salmonella organisms are really spread within such kinds of settings. So they observed, as you can see in the cluster 2, you can see that there is a genetic similarity or genetic sequence similarity between among the salmonella that are identified from animals, humans, and the environment. So it indicates that there is a kind of transmissions, even though we don't know really the clear direction of transmissions, but this whole genomic sequence result really indicates that antimicrobial resistance is really a One Health issue. Coming to the role of hygiene, as I tried to say in the introductory aspect, hygiene, the role of hygiene in prevention and the control of antimicrobial resistance is a kind of indirect mechanisms where preventions of infections. So the primary role of hygiene in preventions of antimicrobial resistance is one, just it prevents an infection. So if there is no any infections, we don't expect any antimicrobial usage or treatment. So that is one indirect role of hygiene. And the second, hygiene can really again limit the spread of antimicrobial resistant organisms once antimicrobial resistance organisms really emerge. So it's indirect way of preventing of antimicrobial resistance. For example, in one literature, just I observed that so every day-to-day improved hygienic conditions like hand washing practices really can result in reduction of risk of infections, especially common infections, by 50%. Really, that is an important intervention. And also it reduces the need for usage of antimicrobials by 30%. So by easily intervening with day-to-day effective and targeted hygiene, we can really minimize the burden of antimicrobial resistance. So that is why just hygiene is really an important factor, and then putting that at the heart of One Health really results in prevention and the control of antimicrobials. So there are a number of studies that really shows the clear association between hygiene and the increased antimicrobial resistance. So as a result of lack of hygiene, there is an increase in infections, and thereby an increased antimicrobial resistance as a result of usage of antimicrobials in treatment of infections. So this is an important study that I came across from one of the developing country in Guatemala. They try to look into the transmission and the role of hygiene at household and the community level. So they try to look into urban setting and the rural setting, and they try to compare the hygienic conditions, and also they try to look at the association of antimicrobial usage and the poor health conditions and the DRS. So in their study, one of the key findings from this study was there is a strong association between antimicrobial usage, poor house hygiene conditions, and the DRI with an increasing of antimicrobial resistance. So here you can clearly see that antimicrobial usage and the lack of hygiene are really a significant factor for an increasing antimicrobial resistance infections within the community and the household domestic setting. So they also try to model or regress these factors with increasing in antimicrobial resistance, and they observed that also of detecting antimicrobial resistance E. coli can be decreased by 32% for every improvement in hygienic conditions, like just using the common hand washing practice as an intervention tool. So, as already Kelly mentioned, so there are many ongoing efforts nationally, internationally, and globally just in terms of hygiene, in terms of antimicrobial resistance. So hygiene is, as you can see in the global, the first global action plan of WHO, hygiene is one of the key elements of the 5 pillars of global action plan for control of antimicrobial resistance. And recently there is one document which is released in 2022, just that shows a strategic framework for collaboration to advance One Health responses to antimicrobial resistance, which is developed by 4 independent institutes. And also, One Health research priority agenda is set and released this document in 2023. So this is an opportunity where we can think how we can integrate hygiene into One Health for the purpose of control of antimicrobial resistance, also any other infection conditions, just by using these opportunities and the framework. Despite all these efforts, but there are still existing gaps in usage of One Health approach, and also even in implementing the well-known hygiene behaviors. Just from the report from GMBP, just many countries are very far behind just in achieving the universal hygienic practices and having the hygiene service. So if in a situation where there is no any hygiene conditions, it is very difficult just to think of about antimicrobial resistance or control of other diarrheal disease or foodborne disease, other inter-infection disease. So there are limitations in effectively integrating hygiene and One Health, just depending on the demand, just like in antimicrobial resistance or in other infectious disease conditions. So the question is how we can maximize just applying or integrating hygiene into One Health, and that is the point for the discussions for the participants, so where we discuss later on during discussions. So thank you very much. This is a piece of information that I try to pull from the literatures just to initiate the discussions. I am really acknowledge the institutions, the individuals who really take part in organizing this event, particularly RGHI, just in supporting the side events and every aspects, and our team in organizing these side events. Thank you very much.
Thanks, Fanta. So we're now going to zoom in a bit to an ongoing project kind of at its beginning, which is aiming to take a broader view of hygiene and understand how we can use it to target specific transmission mechanisms for diseases that have pathogens that have quite complex transmission cycles. So this is entitled Hygiene to Prevent Zoonotic Spillover in a Climate-Changing World, and the case study is leptospirosis in urban Brazil. My name is Max Eyre. I'm a research fellow at the London School of Hygiene and Tropical Medicine, and I'm funded to do my work there by RGHI, who supported this. So the case study for today will be focusing on a specific type of transmission. So this is urban zoonotic spillover via the environment. So zoonotic spillover is the transmission of pathogens from vertebrate animals to humans. And the case study focus here is really looking at pathogen spillover from wild animals in these urban settings. And also specifically looking at pathogens that are transmitted via the environment so that can persist in the environment, survive there for a period of time, which kind of brings the environment into play, but also climate. Why is this important? Well, firstly, trying to extend the focus to a wider range of animals when we're thinking about hygiene, so going beyond kind of domestic animals and thinking about those other animals that live in close proximity to humans. But also, there are a range of different diseases, pathogens that are transmitted in this way that kind of form a neglected but significant global urban health problem. And it's predicted to grow with a kind of extension of these peri-urban areas across the world due to urbanization. We're seeing people living in kind of increased proximity to wild animals and climate change, obviously bringing in an important factor in terms of this environmental transmission through kind of flooding events, adverse weather, etc. So why are we looking at hygiene within this? There's a body of evidence showing that hygiene can be an important determinant for transmission for a wide range of these pathogens with quite complex transmission cycles, but there are still existing key knowledge gaps. So specifically, what are the actual hygiene practices that we can use to reduce transmission at this interface between kind of humans, animals, and the environment? And then secondly, how does that kind of effectiveness of those hygiene practices vary according to flooding events due to climate change, etc., scarcity of water, and other things such as wash provision. So the focus of this specific case study is leptospirosis, which is a leading zoonotic cause of mortality and morbidity, with over 1 million cases, 60,000 deaths occurring annually, mainly in these kind of lower middle income countries in that kind of band through the middle, in the kind of tropical climate region. So urban leptospirosis is predominantly rodent-borne in a lot of settings. There can be a range of other synanthropic animals. Once infected, rodents become asymptomatic carriers. Basically means that they have no clinical symptoms, but just shed the bacteria in their urine out into the environment where it can persist in soil and water for days and weeks. This brings into play climate, so flooding basically means more standing water, so it can persist for longer, but also brings kind of a wider basic exposure to people in their houses, kind of unavoidable exposure as a result of it. So that's why it's a climate-sensitive infection. At the moment, there's no effective control measures, and so the kind of study that I'll be talking about now is trying to understand whether there is potential for these integrated sanitation and hygiene interventions to target it. So the main study aim, it's a just started study, which is going to go on for 3 years, based in the city of Salvador in Bahia, in the northeast of Brazil, which you can see there on the map. You can see a picture of one of the peri-urban communities in which it's set. And the aim of this is really to characterize leptospirosis transmission pathways and identify hygiene and sanitation target points in these communities. So that's in space and time, looking at different places where you might be able to target them, but also at certain time points. So we're trying to account for seasonality here as well. But the case study focus I'm going to talk through here today is really just focusing on this very initial stage, which is how do we actually identify what hygiene practices might be important for this quite complex disease, and then also how do we actually develop a survey to actually measure those reliably. So the study design, it's a 3-year longitudinal eco-epidemiological community-based cohort study, which, as I said, will go on for the next 3 years with 6 follow-up, every 6 months follow-up periods. With over 2,000 participants. Eco-epidemiological here means we're collecting data across humans, environment, and animals. So you can kind of see it there. So we've got an ongoing cohort study where we're collecting serological data and doing a household survey, which includes this hygiene survey, which will be implemented. So that's the bit I'm really going to be focusing on today. But we're also collecting soil and water samples, testing for Leptospira pathogen load, and also collecting data on rat abundance, and then also trapping rats to identify infection rates. So they're kind of all linked together there. And the kind of key point of what I'm trying to get across today is we want to take a systems approach to understand what are the specific hygiene practices that might be relevant to each of these kind of different components. And then we have outcomes now across all of them so we can see where they're actually affecting potentially different parts of the transmission pathway. We'll also be conducting some focus groups to examine this interplay between hygiene behaviors and also kind of the seasonality that we can capture in this survey, and wash provision. So the key aim is really trying to extend hygiene beyond just hand washing and thinking about this across all the possible domains of hygiene and seeing how we can look at that within the context of a specific transmission cycle. So in the first domain, personal hygiene, the kind of main emphasis here is on reducing personal exposure. So basically, rats contacting humans, other infected animals, basically any other mammal can become infected, but it is normally self-limiting. And then exposure to the environment. So measuring behaviors such as contact with the environment, other high-risk activities, the use of personal protective equipment and clothing, and kind of hand and body washing post exposure to the environment, particularly kind of floodwater. And protection of cuts and wounds, as that's how people basically become infected. The bacteria enters through cuts, abrasions, and mucosal membranes. The second domain is domestic hygiene. So here we're just trying to reduce exposure within the household, so reducing contamination effectively inside the household. So you can see there we've marked basically by kind of cleaning up, disinfecting surfaces, reducing the pathogen load potentially within the household, but also the kind of key aim here is reducing rats actually being in close proximity with people within the household. So that's why you can see that reducing rodent density up there. FAHs, food, access, and harborage, which are kind of the 3 things you want to reduce in the environment to reduce the kind of the density of rats in those places. Domain 3 is the environmental component. So here we're trying to reduce the amount of pathogen persisting in soil and water. So that's why you can see land cover management, for example, basically reducing the amount of soil and vegetation and standing water in which it can persist in. and also reducing rodent densities, but this is kind of outside of the house in the peridomestic kind of community spaces by improving the way that solid waste is disposed of and improving cleanliness. But I think a key part also is actually how you deal with these post-flood kind of moments, something that's very, very common in these settings in urban Brazil. Kind of deep valleys become very kind of climate vulnerable, huge flooding events that can take place. And actually in those periods afterwards, how do you kind of improve the area? Obviously there's an important part in terms of infrastructural part, in terms of drainage, but I think there is also a hygiene component in terms of how you basically remove kind of sitting water close and around the house. And the fourth part is animal management. So here we're thinking about domestic animals and their contacts with rats. So basically you can see that arrow there in terms of trying to prevent rats from shedding close to your animals so animals don't then become affected, trying to reduce domestic animals themselves, spreading it amongst the population, and then also trying to reduce those domestic animals from shedding out into the environment close to you and kind of having close contact with people. So thinking about where you're storing your feed, how it's stored, the kind of housing, and I think Liz is actually going to talk a little bit more about that in a slightly different context later, and improving general environmental cleanliness and thinking about how you have contact with your own domestic animals. So at this point, it's very much ongoing, but I just wanted to highlight some of the kind of key considerations that we've been having so far. So I think a big component of it is trying to think of hygiene in kind of this broader context, going beyond just the kind of classic thought of, okay, is it just hand washing, and thinking about what is hygiene in the environment and close to the household. Using this transmission systems approach, so trying to actually think, okay, for this specific disease, can we measure specific outcomes, and then can we look at which hygiene behaviors might affect them. The third part, trying to have a kind of accurate and standardized measurement of hygiene behaviors. This is something that at the moment really there hasn't been that much work on, but April, who we actually has done such relevant work, we've invited her to come and give a case study in the next presentation. I think can talk a little bit more about that and some of the work that she's been doing. And then finally, using these eco-epidemiological approaches to collect multiple outcomes across the transmission pathway so we can see exactly how hygiene might be affecting it. Importance of community participation in terms of understanding practices, but also developing interventions. And then finally, what we're trying to capture here through the seasonal, every 6 months approach in the study is actually understand how does this change with climate change, with flooding events, and does that kind of, is that the barriers to hygiene practices and kind of how they vary over time. Thank you very much. And I will now pass over to April Ballard.
Thank you. So I think everyone's done a pretty good job at introducing the topic, so I'm just going to dive into my work and the case study. As Max mentioned, I am going to be talking about the measurement of zoonotic enteric pathogens, specifically thinking about children, but when we have our breakout groups, this kind of applies to the topic broader. And we see across measurement of different types of One Health issues that there are diverse approaches. And so we tried to look at this specifically in the Ecuadorian context. And the goal of the project overall was really to improve and inform the conception and measurement of child exposure to zoonotic enteric pathogens. Here, we're specifically interested in transmission through animal feces, but also leave it open for the fact that there can be some transmission when there is direct contact with animals. But note that we are primarily focused on animal feces here. And so this was done with 3 major aims. The first was really thinking about how are children exposed, in-depthly trying to characterize that. The second was how has exposure been measured, so zooming out and understanding the landscape of measurement. And then the third was actually thinking about how can we actually standardize measurement and create some sort of quantitative measure of child exposure. And for time's sake, I'm only going to be focusing on the first 2 today, or the second 2, but I'll be around, so if anyone's interested, I'm happy to talk more about that. So we started with this larger systematic review, which is published in the International Journal of Hygiene and Environmental Health, so feel free to look it up later. But we were interested in looking at not only how child exposure has been measured, but human exposure at large to animal feces. So we conducted a systematic review to look at all the quantitative approaches to measurement that have been conducted over the years, and we found 184 studies, and among those studies, there were actually over 1,400 quantitative measures. From there, we categorized measures in two ways. First, we used this framework of exposure, thinking that in order for exposure to happen, we need animals, we need something in the environment, and we need human behavior. And through that, through our review, we also identified another kind of component of exposure that people were measuring, which was what we labeled as evidence of exposure. So that's when we can see direct human and animal shared characteristics of exposure. We then mapped the measures to the exposure science conceptual framework to see what they actually measured and how close they were to that actual point of exposure. So that is when feces and associated pathogens actually enter the body. And all of this, we're really emphasizing behavior here because it's so essential to an exposure like this. So this figure summarizes the main findings from the review. The colors represent the different components that I mentioned. And then the x-axis, we have the exposure science framework, and then the y-axis is the number of measures that fit into those categories. And so overall, the takeaway is that measurement was quite diverse across studies, and they were overwhelmingly distal from the actual point of exposure. So we see the majority of measures are measuring something about the source or the contaminant or the concentration of that contaminant in the environment. Only 9% are actually capturing anything about behavior, and very few are close to that actual exposure interface. And so this really just highlights the need for standardized approaches to measurement so that we can compare across studies, but also more proximal measurement of zoonotic exposures, particularly emphasizing that behavior is essential here and should be included in measurement. We then took that, as well as some qualitative research that I alluded to earlier, and developed a quantitative survey to try to create, or at least start the process of creating a global standardized survey-based measure that can assess child exposure. And we conducted this work in northwestern coastal Ecuador among mothers that had children under the age of 5. And so we drew off of that systematic review and created this, this framework of conceptualizing exposure as two different domains. There is information about the child environment, which is where the animals fit in. You can see they map here. And then there's information about child behavior that we're interested in. And this was also then mapped again to that exposure science conceptual framework. We crafted items so that they fit into each box there on the exposure science conceptual framework, and then questions were asked to mothers about how often a particular event or behavior occurred in the last week on a Likert scale. So never, rarely, sometimes, frequently. And then items about source and contaminant were actually asked about specific types of animals separately. Our analyses led us to create a final measure that included 7 components and 34 items. So items fit into these 7 categories. And then we created a simple measure that others can use to essentially just summing this, creating a quantitative measure where the Likert scale has values of 0, 1, 2, and 3. You sum those based on the responses, and you get a continuous measure of exposure for children. This allowed us to see that children had an average score of 27 out of 102, which is a little challenging to interpret, but Interestingly, we see that only 2 children had scores of 0, and comparing this to typical measures of exposure that are used frequently, such as animal ownership and presence of animal feces, those measures would have given us 44% of children having no exposure and 33%. So the potential for misclassification with those binary types of measures is a little bit increased, and so we're able to have that relative intensity of exposure with a continuous measure like this. And then we can also look at scores across those 2 domains. So understanding perhaps what part of the environment is contributing to exposure, should we intervene there and how, and this vice versa with behavior. And so this measure is definitely an important first step to improve and standardize measurement. And importantly includes environment and behavior subdomains, which, as I alluded to in that first part of the presentation, is quite unique in this case and really important. And with that, I just want to thank all the people that worked on this project and also our funders. And my email is on the slide. If anybody has any questions, you're free to follow up. Thank you.
Okay, good morning. I am Liz Thomas, and yes, so I am an RGHI fellow at Johns Hopkins, as well as Windward Islands Research and Education Foundation, and we are going to carry forward into the next case study by sticking with the idea of children's exposure to animals and animal feces by looking at poultry-raising households in rural Bangladesh. So I think we've established that hygiene in domestic animal agricultural settings is important to public health. And typically in public health, we think about hygiene interventions and their importance for human health. But we are also thinking today about their relevance for animal health and the health of the shared environment. So today we're going to think about hygiene behaviors and conditions that are relevant to all 3 in the context of poultry-raising households in rural Bangladesh. And for some background on this setting, small-scale poultry production is important to the livelihood of rural households in the lowest resource settings. And in these settings, the most common form of poultry raising is called an extensive scavenging system. So that's where households own between 1 to 50 birds, and they generally provide little input to those birds. They scavenge during the day for food, and at night are housed in either minimal housing or are housed within the household dwelling along with poultry raisers. And despite the benefits that poultry bring to households, they also contribute to fecal contamination of the domestic environment. And there is some evidence that housing poultry inside the dwelling overnight can increase household members' exposure to poultry and poultry feces. So this study that we're talking about today was part of an effort that was funded by the Wash Pals Initiative and led by ICDDRB in Bangladesh. And the objective was to inform the content and implementation of a WASH intervention that was targeting children's exposure to poultry feces. But today we're going to zoom in and think about what we learned about overnight poultry housing and feces management. We're first going to characterize the hygiene situation in the setting and then talk about how that informed the development of an intervention. So to characterize the hygiene situation, we first conducted transect walks. We did 19 of those across all of the 8 divisions in Bangladesh. And we did this to identify and photograph poultry housing practices as well as feces management practices. We then zoomed in and did semi-structured interviews to further explore the housing practices and feces management practices that we had identified, as well as better understand opportunities for human and poultry interaction. So turning to the results on poultry housing, we found poultry housing both inside the dwelling and separate from the dwelling, and we categorized the housing into 3 main types: cages, barricades, and sheds. So it was common in this setting to keep poultry in a cage, a bamboo cage, that was then placed under a bed or under a storage area. It was also common to use various materials to form a barricade and keep poultry under furniture or in a corner of the room. And then looking at the housing that we found that was separate from the dwelling, we also found cages, barricades, and those were located in kitchens or other animal shelters. And then we also found house-like structures that had walls, a roof, door, and sometimes ventilation. And we found those mostly in courtyards outside, and we will call those sheds. We found a lot of variation in shed design. Materials ranged from corrugated iron, wood, bamboo, cement, and we also saw that there were a lot of different features in those sheds. So some had single compartments, multiple compartments, and some had ventilation, some had no ventilation. And this really allowed us to have a better sense of what the animal management, domestic, and environmental hygiene domains were looking like in this setting, and how they were relevant to human, animal, and environmental health. So for example, the proximity of a shed, which varied to the dwelling, could impact contamination of the surrounding environment as well as bodies of water. And then thinking about how we saw that variation in the shed design, whether or not there was ventilation, the size of it could affect crowding of the animals and then impact animal health. So turning now to our findings on feces removal practices, we found that the person who was primarily responsible for removing feces from poultry housing was the primary poultry raiser, and in this setting, most of those individuals were women. The primary removal method of feces was to place a plastic sheet with some ash into the housing, and then that could be removed with the aid of a spade or hoe, hands, or by sweeping. And then we found that there was some variation in how often feces were being removed based on the location of the housing. So for poultry housing that was inside the dwelling, the interval was generally short. It was either daily or every other day. But then when housing was outside the dwelling, it could be daily that feces were removed, or it could even be wider intervals up to monthly or longer. We also looked at where feces were then disposed, and this ranged, could be on the household garbage pile or in a pit, directly onto the roots of trees, into agricultural fields, and also directly into water bodies. We also asked about hygiene practices after feces removal, and we found that there was a mixed report of hand washing with soap, and oftentimes poultry raisers said that they would not wash hands with soap if they used a tool such as a spade or hoe to aid with feces removal. We did, however, find that it was very common to take a bath or a shower after cleaning poultry housing, and when we asked why, it was often due to the smell after cleaning poultry housing and due to concern of germs. So again, this really helped us better understand these domains of hygiene in this setting and think about how these could impact human, animal, and their shared environmental health. So for example, the different disposal locations, if it's directly into a body of water, could contaminate that water, which has implications for all three, humans, animals, and the environment. Removal intervals could impact animal health as well as human health. And then thinking about the removal practices themselves, this really highlighted important gendered roles, and also the removal practices could impact exposure. So what did we do with this information? We developed a behavior change communication intervention where we focused our communication on the health risks to children and household members from keeping poultry within the sleeping dwelling at night, but also the health risks to poultry from crowded, unventilated housing. We also touched on the concerns for contamination of the surrounding environment from poor feces management. And as part of the intervention, we had three main recommendations. One was to build an improved poultry shed. One was to dispose poultry feces in a specific place, such as a covered pit away from the living space. And then we also had a hand hygiene component. The improved shed that we recommended, we suggested that it be raised from the ground in case of flooding. We suggested cross ventilation as well as multiple compartments so that households could house their entire flocks. And we also asked that these sheds be outside in the courtyard but away from the household dwelling. So where are we now? We did a pilot study of this intervention from 2020 to 2021, and we saw good uptake of the behavioral recommendations. We will now be going back next year to look at the durability of the intervention, as well as look at how the intervention modified fecal contamination of the domestic environment. And this really allows us to think about some questions for this upcoming discussion session on what are opportunities for hygiene and One Health integration. So when I think about this case study and others today, I think, can we expand hygiene interventions beyond a focus on human exposure to animal feces? So could we, for instance, think about the impact on animal health and environmental health? Are there opportunities for integration, such as into food hygiene interventions? And then how can we design effective behavior change interventions? Are there motives for behavior change beyond human health, such as thinking about animal health and environmental health? And with that, that is the end of this presentation. I'd like to acknowledge the study team, as well as our funder, USAID, from the Wash Pals Initiative, and ICDDRB for their implementation of this research, as well as RGHI for my support. Okay, thanks so much. And now we are going to move into our breakout session. This is a little different from typical breakout sessions. We're doing a World Cafe method, which is a hopefully fun round-robin experience where we are going to ask groups to move around from station to station, spending about 5 minutes at each. Hopefully you'll hit 3, 4, or even 5 of the stations that we have. And we are going to be thinking today about 5 key areas that we think we need a little bit more thought on for how to best integrate hygiene and One Health. So those topics that we'll touch on today are: what are the key research areas for this integration? What is the research methodology? Intervention development, considerations for evaluation of interventions and programs, and then how to best translate research to practice. So for each of these breakout groups, we would ask that you think through what the priorities are. So what do you think is the most important for hygiene and One Health integration? And then what are the challenges? So we hope that you can bring some of your own experience to this part, thinking through why it has been hard to achieve integration, and then also what challenges you might anticipate as part of this process. So this will work by, we are hoping that we can form groups of 5. If maybe 5 from this section can start at group 1, 5 from the back section can start back at the number 5, yellow part in the far corner, and then likewise 5, 5, and 5. And then if we can rotate, we will let you know when to rotate about every 5 minutes. Then what we'll do is the first group might kind of start generally, and then as you move, we will let you know what the last group talked about, and we will try to expand further and further until we come back together to see what everyone was talking about. Okay, I will give everyone a few minutes to reorient, and we will get started.
So if each of the moderators for each station could go to their station, and then if people just find a station, and hopefully we'll have roughly equal numbers.
That we just kind of start writing down gaps that we think are in
came here to learn, and I'm like, oh, okay, I try to think of gaps in hygiene. I don't know, like, a ton of
Well, I was thinking scat identification. Scat identification? Yeah, like when I was a wildlife docent, when I was in school, we did a lot of scat identification. It's like research officers or research assistants would be trained on that, not to select samples, but to quantify the different types of species that are there. And I know some people are doing that, but I'm not seeing a lot of studies on that. I was looking to see if I could find a map that I was thinking about, but I don't know if that's
They're looking at the source assessment.
yeah, to look at the different types of species that's present. Sometimes we'll say it's animal species present or species that are present in general, and that's something that we do. But we can actually train people to identify the different types of species. Some are easy, like chicken.
Yes, yeah, but like dog is harder. Dog, you know.
And guinea pigs will probably be, then it could be, guinea pig and chicken, I'm not sure. Yeah. Like scat identification. Yeah. Have you seen people do that?
I mean, like, for example, we've certainly tried that in our studies, but we hear from enumerators sometimes, and sometimes people know exactly what it is.
You have to be trained on it.
I mean, I like scat identification, or is is mapping in the sense of, kind of, if you're going to do an environmental health or environmental inspection, and you're trying to see where it's coming from.
You can even do like a little map and mark off where your findings.
All right, so, and we'll keep writing, you don't have to adjust. Because, I mean, well, other people are not supposed to be adding on. Right, lack of environmental hygiene and sanitation as a driver of connections, correlations between childbirth, stunting, and And tied to that is also like the circular relationship rate. We talk a lot about domestic animals and transmission like chickens and stuff. But what about cats, right? There's certain animals that are just kind of intimately pulled to us that are not part of food. So there's different kinds of staff mapping, understanding risk and.
And this was just a picture of what I was talking about. So like they have a lot of maps like that that you would give to the resource officers and they could just be able to go. We're not using it. Like, yeah, no, like you totally could. And I remember they had us trained, we had to mark, and they were like, no, that wasn't the right type.
So understanding risk and behavior variability across settings, like household markets, and by animal, which is the connection. So at least thinking about the behavior, right?
rabbits were put outside and they would die instead of cold for that. And so for that reason, they were having very close contact with people. And so I think that could play a role also.
Do you see tularemia in those populations?
We haven't measured it. So we have people that said, we haven't looked at the different types of zoonosis in that particular context. We have actually the animal pieces samples and are trying to get funding to analyze them, but we haven't done that yet. Yeah. But we did a project where we constructed animal hutches. We actually did it based on the design of the kitchen already. But it was inside, unfortunately. They refused to have it outside because of security.
That says maybe pathogen specificity is needed, like think about what pathogens are present in the water supply or present in the feces. We need more research on technology tools to make that easier to do in the field and cheaper to do.
Yeah, that would be really nice.
We spend a lot of time talking about water safety and food safety for humans, but not for animals. I like the idea of using a dog. Yeah, I know.
I missed the first part of it, but it was to ASPCA, call them dogs, largely dogs or domestic.
Yeah, well, I mean, those things we want to mention.
Following exposure to water bodies, I think, but I missed that. Right, and then we know that that's an lower risk for humans.
Yeah, absolutely. Well, I mean, cyanobacteria, right now, cyanobacteria is a big problem in Iowa in summer and spring. The blooms happen. Public health response is very one healthy approach. Like they put up signs saying, keep yourself and your dogs
It's a really tricky one, and it's not the same.
communication.
Which is why it's not.
Right, so I think we'll
Can everyone take a move that way? So 1 to 2, 2 to 3, yeah.
ideas, research gaps that might lead to interventions that are multi-pronged and multi-benefits. These would be really important research. So what I want to do is just quickly summarize what the last group said, and then ask you all to either, if there's something that you think is missing here, you can write it on the sheet. You can also come up, you know, if you're close to something that's here, you just sort of want to build on it. You can add more information that's here. Also, I kind of organized them more so that it seems to be themes, but you can also be like, well, that's so connected and make them around the tree, so it's really great. Two ideas that came up really related to sort of environmental context, like hygiene included sort of hygiene as a driver of harm, so how much contamination the environment or cleaning protocols are related. Sanitarians or, so if you guys have to assessments, fecal pollution in the environment and where is that coming from? Sometimes it's really feces on the ground. Is this human? Is this a human sanitation issue? Is this a dog? Right? Where is it coming from? And there are actual maps that are existing right now of scat contamination. They're disseminated. Connections, correlations between child growth stunting and hand hygiene. This is about assessing hand hygiene as it relates to anthropometry. Then here we had some more behavioral types of suggestions. These were so the conversation here is really about how people's relationships with animals can really modify whether they have intimate contact with them or not. Pet companion animals are close to us all the time, right? We snuggle with our cats and dogs, which depends on where you are. Sometimes these animals are also food production animals, and so we might see, like small animals, when animals are babies, maybe they're perceived to be safe, and there's more contact between people and those animals, and then as they grow to become giant pigs, for example, they get moved out. So there's not a whole lot of research on how relationship to animals is and then in this group here, we were really talking about sort of how we have these systems in place for thinking about drinking water and food safety for humans, but we don't have a lot of research on what quality of water is that's not going to food that's given to animals. And so we may be giving them poor quality water food that what we consume that can cause an infection, and then an infection that causes a risk to us as well. So if you have other research gaps that are post it up here where the is relevant. And again, you can add on if they doodle what it looks like.
And like have to turn on, they can get into things.
Think about your own research areas. Is your research area something that is an unneglected or neglected?
Yeah, for me, a lot of the research that I've done tends to focus on development or
Basically like environmental surveillance for both. But then it has to depend on schools, the trees workforce. You know, I mean, I know in the next few pounds I will convey, the more detail. But anybody else?
things that are put into it.
Okay, everyone. I think in the interests of Okay, everyone, in the interest of time, I think we'll do a quick wrap up. So we'll just go station by station, and the moderator can give us a quick overview of the story of kind of what's appeared so far. I can go first on my one, or do you want to go ahead and start first? Yeah. Okay. We're just doing the wrap up. So due to the interest of time, we hoped we'd go around every single one, but time has escaped us a little bit. So we're just going to go around each station and give a quick wrap up of kind of the key points and the kind of story of how it's appeared. So over here at research methodology, a lot of talk about how we measure these exposures and these kind of behaviors, particularly the kind of methods that we use, whether they're kind of mixed methods approach. But I think a lot of focus here of the discussion, particularly in the previous group, has been on kind of structured observation versus unstructured observation, how you avoid bias, how you might be able to use unstructured observation to inform your actual structured observation as well. Measuring, kind of deciding exactly how you're going to measure it using kind of standardized and validated measures that we kind of discussed before. Wide range of different approaches, kind of lab, survey, observation, which I've spoken about, but particularly trying to understand when we have these complex pathways, how we can measure across them, and then how we can actually analyze that data together. So that was another point kind of relating to, like, if you're collecting data on humans, animals, environment, how do you even kind of bring those together in a moment? What sort of at the place? Is it just the household location? At what time? How do you structure your survey so that you can link those outcomes together and kind of analyze them together? Another key point was thinking about animals before you get anywhere near the household. So in terms of consumption and food systems, fish, meat, etc., that's coming from far away, and what is the process actually that's led it there? How do you account for that, and how can you measure for that in your system? Which I think is particularly important. I study Toxoplasma gondii and how that kind of infection can reach the households. Other kind of key points were, how do you get reliable measures of particularly animals that there might be stigma associated to? So rats, for example, how do you kind of deal with stigma and also recall bias, which was something that someone had kind of been aware of within a study that they had done. So I think that's... Oh, no, another one was actually, how do you measure interactions between animals? The kind of what is going on between those animals and the environment away from the household, and how can you kind of measure for that and account for that? Is it trying to use GPS, again, more observation, or can you just use caregiver surveys? Yeah, so that's everything from over here. Who wants to go next? Do you want to go next?
Yeah, sure. So we had a great discussion about intervention development. One of the first things brought up was, how do we make sure that the burden of an intervention doesn't fall on individuals or households? And a thought was how to better engage the community and government in order to support individuals and households for interventions. And one thought there was possibly increasing vaccination campaigns so that you could mobilize an entire community for vaccination. And then also thinking about, are there opportunities to have something similar to a community health worker cohort, but specific for animals? There was an example from a study in India that had a group called Friends of Animals that helped to support vaccination and other efforts to improve the health of animals. And that was another really big consideration. So if we're going to engage veterinary public health, how to best engage them, engaging local vets as well as other veterinary experts to think really about how to keep animals happy and healthy, thinking through things like how big of a coop do we need to make sure that chickens have enough space that they are happy and healthy. And then how does keeping animals healthy also support households in terms of allowing them to have better outputs? So could they sell their animals for more money? Could they raise more animals and sell those for more money? And then we also thought, if we're engaging public health experts for human health and veterinary experts for animal health, who would we be engaging for the environmental health component? And that actually kind of went unanswered. So that's something for everyone to think about a little bit. But we also thought we need to engage people who are thinking about the economics of all of this as well, because there are opportunities for non-health motives for us to think about, especially around income, as well as the health of animals. And then we also talked about how it's important to not only consider the animals that are alive, but also ones that are dead. So both animals that have passed away from disease, but also animals that are slaughtered for food. So also thinking through how interventions address slaughter waste. We were also talking about norms around animal husbandry and how to make sure that interventions think through what the existing practices are, and are interventions truly necessary, or can we modify existing practices to better serve health outcomes? So for example, we were thinking about the earlier example from the case study in Bangladesh where household members would bathe after cleaning poultry coops. Is there a way to think about modifying some of the daily life activities to utilize that hygiene event to carry forward and, for instance, maybe have food preparation or serving happen after that event? I think, yes, we were also talking about advocating to local leaders and not just village leaders or community leaders, but also thinking about community organizations and how they can support interventions. And then also integrating interventions into school curricula as well as existing vet services. And there was lots more, but I think for time, I will pass it on to Julie.
Yeah, great. Ooh, this is working, amazing. So I think the discussions around evaluation highlighted that there's a really wide range of priorities and also a huge amount of challenges when it comes to evaluating some of these interventions. I think discussion ranged from thinking about the way that we orientate research questions, whether they're all focused on the deficits and costs of not doing particular behaviors compared to thinking about the potential gains and even framing outcomes more towards benefits rather than costs or negative outcomes. I think that flows through probably prior to interventions as well as then coming through to evaluations. We had some time talking about, the importance of getting the intervention and process evaluation right. I think there's a lot of role and the group talked about having a lot of role for process evaluation in this because there's so many different components that are going on, so much that can be happening in interventions, and so making sure that by the time we're getting to evaluation that it's something that's actually worth evaluating. The group talked about, the difficulty of defining or really getting right this measurement of the level of exposure as well as the outcomes that are being considered in the context of research more broadly as well as in the evaluation of interventions. Similar to, I think, what we heard in terms of intervention development, thinking as well about how this is going to be communicated to policymakers and translating things into dollars or health burdens in a language that's going to be taken up by those groups. And we also, the group talked about the evaluation of process. And so, we're trying to get different stakeholders, different groups that don't usually talk to each other to talk to each other as part of this. How is it that we're actually able to do that effectively and sharing some of the lessons learned and challenges from that as part of evaluation? Lots of discussion on wide-ranging topics, so I'll pass it along.
I'll move up here so you don't have to crook your necks round and you can look forward for once. So a lot of overlapping themes going on, but I think there were three main areas. One was the whole One Health agenda. There is clearly a big integration challenge there, which requires us to think much more about translating language between different disciplines and trying to be able to speak across different expertise areas and fields and sectors and so on. The second area was thinking about, again, cultural approaches, being mindful that animal husbandry has significantly different contexts and that the issues of proximity shouldn't be discounted, that we should be thinking about there may be transgressions made if you are thinking about separating animal husbandry increasingly from the household, and that may be an established practice in farming practices, for instance, in many northern countries, but animal husbandry may have significantly different social contexts within different settings. And then the third and last area was that the hygiene agenda presupposes that the infrastructures are in place, that there is wash in the household, which enables hygiene practices or makes it easier, and so on. So we ought to be thinking much more proactively about pushing for water access in all households, as the SDG target now suggests that we ought to be having a household water supply. I'm doing that very quickly because I just had the benefit of one group and I wasn't allowed any others. So, so that's it.
All right. So this is the key research gap area here. I think where I want to start is perhaps on the environmental hygiene end of things. It had this sort of theme was related a lot to the concept of measurement. So understanding, how environmental hygiene, both the contamination and the mitigation behaviors that might be practiced, impact the transmission of antimicrobial resistance was one suggestion. Scat mapping was an idea that was brought up and is actually enthusiastically reinforced in the second round of people that came to the group. And this relates to this concept that if we're doing observational environmental assessments, looking for sort of fecal contamination to identify impacted areas, it can often be very challenging to untangle what the source of feces in the environment might be. And so there may be inconsistent training among people that are deployed to do this in terms of, well, is this human poop or is this dog poop, right? Because that suggests very different types of interventions. And so there are already sort of existing tools that are out there, visual tools that are used in the wildlife sector for, sort of trying to identify sources of scat or feces. And these could be scaled up more broadly. Tied to that concept, the concept of environmental surveillance, the kind of the extension of wastewater epi, but for rural areas. There is, sort of not a lot of information about which ecological indicators or organism indicators might be ideal for this. There is not a clear sort of concept in terms of sampling strategies, how much do you survey and where, and then also tools. There's not the tools that are available for a lot of very precision-oriented environmental surveillance are high tech and not easy to deploy in some of these more rural areas like they can be used in urban areas. Tied to the concept of measurement, measurement also kind of came up in behavior. So the conversation around behavior emphasized a need for better ways to understand, or more information to understand the risks from different behaviors, both to environment, but I think we spent more time really talking about animals. And with the concept of animals, what we were discussing is that animals play a lot of different roles in our lives. We have companion animals that we keep very close to us. Some people sleep with their cats and dogs and guinea pigs and chickens and such, very quite purposely, sometimes for safety, but sometimes for mental well-being. But that also means that we are bringing them closer to us as potential vectors. And so the health of those animals, is very important to prevent that sort of transmission. We also talked about the concept that, as animals age, how we view them, either as potential risks or as food sources, can evolve. So we may have baby pigs that children cuddle with and play with, but then when they become gigantic pigs, they get put in pens and then eventually sent to a food production chain. So we don't know a lot about how the human interaction behaviors, what are the drivers behind that, and how might that evolve with both human age as well as animal age. That sort of concept of trade-offs, tied to animals also emerged in a different set of conversations that were tied to like how we treat animals. So we spend a lot of time, we do a lot globally for measuring drinking water quality and food safety for humans, but there's not a lot of information about the safety of the water that we give to animals or the food that's given to animals. And so if we are prioritizing the quality of what's given to them as sort of less important than ourselves, then we may be inadvertently sort of creating vectors by the behaviors, by our sort of caregiving behaviors. In another point that was brought up tied to this, but more up in the food chain, is that, when we talk about food production, there are often some practices that have trade-off benefits. So for example, antibiotics have been used for increasing the size and the health of chickens that are sent to the market. And while that addresses malnutrition, food insecurity types of issues, it creates AMR problems. And then last, seasonality came up. The impact of seasonality and extreme weather on animal husbandry behaviors as well as transmission pathways. So for example, floods, how does floods impact emergence of disease in humans and in animals?
Amazing. Thanks everyone so much for your participation. I think we've stolen a few minutes of coffee break from you, but lots of fantastic ideas, so thank you very much for attending. Appreciate it. Oh, thanks.